Did you know an estimated 1.9 million brain cells die per minute during a stroke? This event can shatter lives in mere moments, leaving behind a trail of physical, emotional, and financial challenges. Yet, behind many of these strokes lie several risk factors that, if addressed early, could prevent such devastation. Join us today on Good Cup of Health as we explore the controllable stroke risk factors and uncontrollable stroke risk factors that contribute to a life-changing and potential deadly stroke. Let's jump right in. While men are more likely to have a stroke than women, experts from stroke.org state that women's chances of dying from a stroke are higher. It's the number 3 cause of death in women. Some risk factors for stroke in women include generally living longer than men, some forms of hormonal birth control, for example, low-dose estrogen pills, preeclampsia, pregnancy, and hormonal replacement therapy during menopause. Now, let's look at the highest stroke risk factors for men and women. Unregulated high blood pressure is the leading cause of stroke. How exactly does unchecked high blood pressure lead to stroke? Experts warn that high blood pressure increases stroke risk because over time, it damages and weakens blood vessels. It can also lead to arteries bursting or clogging easily, and blood clots can form, blocking blood flow to the brain, inducing a stroke. In her chapter on the kidney's role in weight loss, Leah Matlis mentions how high aldosterone levels could be a potential overlooked factor in high blood pressure. Experts from clevelandclinic.com and blackdoctor.org state that aldosterone is a hormone that the adrenal glands produce to help regulate blood pressure by balancing sodium and potassium levels in our blood. When aldosterone levels get too high, sodium retention and water reabsorption in the kidneys occur, raising our blood pressure. This condition is known as primary aldosterone or high aldosterone. Experts from adrenal.com warn that if someone with high blood pressure is not responding to blood pressure medication, they may have primary aldosteronism and should see a specialist. They also note that the most common symptoms of high aldosterone are high blood pressure, fatigue, and muscle cramps. Because high aldosterone or primary aldosterone is often misdiagnosed or overlooked, it may require the patient to be vigilant, as was the case with a woman when her doctor initially chalked up her symptoms to stress from recent childbirth. Her self-diagnosis and vigilance led her to specialists who were able to confirm her suspicions of her symptoms with the right tests and treatment. For testing, doctors may start with the aldosterone to renin ratio, ARR test, a blood test that measures the ratio between aldosterone and renin and reveals primary or high aldosterone. Some doctors may take it a step further with MRI scans of the adrenal glands or specialized urine testing. On to the next stroke risk factor, chronic dehydration. Experts from the Premier Medical Group state that chronic dehydration could lower blood pressure at first, but then the body tries to correct this by releasing hormones that trigger the blood vessels to narrow, potentially increasing blood pressure. And then some studies show that chronic dehydration increases stroke risk because the blood thickens up, which can create blood clots and block blood flow to the brain, depriving it of vital nutrients and oxygen. And electrolyte imbalances from chronic dehydration could disrupt the heart's rhythm, causing irregular heartbeats that increase the likelihood of a stroke. And lastly, as we get older, the water content in our bodies gets lower, and our natural thirst cues also decline, putting us at risk for dehydration, which becomes chronic if we don't drink enough water throughout the day. Smoking is another leading stroke risk factor. If you smoke, your chance of suffering a stroke significantly increases, and the risk of ischemic stroke in current smokers almost doubles that of non-smokers. Experts from communitycare.com state that smoking increases clot formation, thickens the blood, and increases the amount of plaque buildup in the arteries. Diabetes is another risk factor for stroke. Experts from WebMD state that people with type 2 diabetes usually have high blood pressure and are overweight. Being overweight or obese increases your stroke risk due to many factors, with chronic low-grade inflammation being one of them. High cholesterol levels increase stroke risk. This also includes a type of cholesterol called LPA. In her chapter on the liver's role in weight loss, Leah Matlis references lipoprotein A, or LPA, as another overlooked risk factor for stroke. LPA is, quote, an LDL-like particle that's considered more dangerous than regular LDL cholesterol because it's stickier and more likely to build up in blood vessels. According to experts, including those from Medscape.com, 1 in 5 people globally could have high LPA and not know it, increasing their risk for heart attack or stroke. Experts from Medscape.com state that LPA is not significantly affected by lifestyle choices or medications like statins, and high levels are mostly brought on by genetic factors. Even with low LDL cholesterol levels, high LPA can be a risk factor for stroke, according to Medscape.com. Additionally, Black people are more likely to have elevated LPA levels than white, Hispanic, or Asian individuals, according to research from Family Heart.org and Medscape. Unfortunately, even though it should be, LPA is not part of routine cholesterol testing, leaving many people unaware of their potential risk. Now on to what experts would consider mostly uncontrollable stroke risk factors. If there is a family history of stroke, then you are more likely to suffer one in your lifetime. Age is another stroke risk factor. The risk of having a stroke doubles each decade after 55. I should quickly mention that strokes can and do happen to people under 55, but about 75% of them occur in people over age 65. But it's important to mention that more younger people are having strokes now than ever before. And as experts point out, what used to be the typical age for strokes is gradually decreasing. They have also pinpointed several reasons why more younger people are having strokes. Rising obesity rates, rising high blood pressure, sedentary lifestyles and lack of exercise, diets that favor processed foods, and type 2 diabetes being diagnosed more in younger people are the main factors. Experts from University of Colorado Health.org state that 60% of people under 50 years of age in the U.S. who had a stroke had an ischemic stroke. This type of stroke is caused by a blocked vessel. Race and ethnicity may also predispose a person to a stroke. Research shows that Black Americans and non-white Hispanic Americans are more likely to suffer from strokes than other groups in the U.S. Your medical history can increase your chances of stroke. If you had a transient ischemic attack or TIA, your risk increases. If you have atrial fibrillation, your risk for stroke also increases. Carotid and other artery diseases are also risk factors for stroke. Untreated sleep apnea can also increase the risk of stroke. Narrowed arteries from plaque buildup or fatty deposits could eventually become blocked, putting a person at risk of ischemic stroke. Now we will shift back to some more potential controllable stroke risk factors. 1/3 of U.S. adults suffer from at least one of these conditions: type 2 diabetes, high cholesterol, obesity, or high blood pressure, increasing their risk of stroke. If you drink a lot of alcohol, it increases your stroke risk. I must also mention that the typical diet in the U.S. predisposes many to stroke. Diets high in unhealthy fat, salt, added sugars, and refined grains are detrimental to our health and waistlines. And then, if lack of exercise and little physical activity is added, our stroke risk dramatically increases. Unhealthy diets, lack of exercise, and little to no physical activity can lead to high blood pressure, high LDL cholesterol, type 2 diabetes, heart attack, and stroke. Mineral deficiencies can increase your risk of stroke. Potassium and magnesium are essential minerals for maintaining blood pressure and promoting cardiovascular health. And experts from ncpic.com warn that if magnesium levels are low, potassium might also be low. Research shows that severe deficiencies in potassium and magnesium increase your risk of cardiovascular disease and strokes. For example, women who ate foods higher in potassium reduced their risk of stroke and dying when compared to women who ate foods low in potassium, according to recent research published in Stroke, the Journal of the American Heart Association. Did you know that long periods of sitting can increase stroke risk? And experts from the Mayo Clinic warn that poor sleep can increase the risk of stroke. Certain medications like blood thinners, proton pump inhibitors, and, interestingly enough, non-inflammatory drugs or NSAIDs, which are common pain relievers like ibuprofen, could increase stroke risk if heavily used. Other medications that could increase stroke risk if heavily used are antidepressants. According to experts from EasyHealthOptions.com, the United States leads in antidepressant usage. So there we have it. These are some of the most common and uncommon risk factors that could increase your stroke risk. Understanding the risk factors for a stroke is the first step towards prevention. Some factors like age, genetic predisposition, or rare medical conditions aren't within our control. For controllable stroke risk factors, staying informed and making lifestyle changes can make all the difference. Remember, small actions today can lead to a healthier tomorrow. Advancements in technology are providing new ways to manage and reduce stroke risk factors. From wearable health tech to digital platforms, staying informed about your health has never been easier. Share your knowledge with family and friends to build a supportive network for lifestyle changes. Together, we can create a healthier community. But before we go, did you know our bodies can warn us that a stroke is coming? You'll want to check out our video on how your body silently warns you weeks in advance of an impending stroke.